Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, I have earned a lot, and now to return a lot to the world. The topic of today is restless leg syndrome. And restless leg syndrome is abbreviated as RLS. It is also known as Willis-Ekbom disease, WED, Willis-Ekbom disease, or Whitmack-Ekbom syndrome, WES, or shaking leg syndrome, unhappy feet, nocturnal myoclonus. These are the other names for this disease. It is a neurological sensory motor disorder with irresistible urge to move one's body to stop odd sensations. The leg pain of RLS eases with motion of the legs and becomes more severe when the person is at rest. Worsening of the symptoms and leg pain during early evening or late at night occurs. It mostly affects legs, but it can affect arms, torso, head, and even phantom limbs. Now, here one can see what is the restless leg syndrome, the pain in the leg, and it is just having the feeling of something inflamed or swollen, and here one can have the pain at this area of the leg. Restless leg syndrome, moving affected the body parts, modulates sensation, providing temporary relief. WED or RLS sensations range from pain or an aching in the muscles, an itch one cannot scratch, an unpleasant tickle that will not stop, or even a crawling feeling in the limb is there. The sensations begin during quiet wakefulness when relaxing, reading, studying, or trying to go to sleep. And here one can see the burning, aching, or electric shock feeling, crawling sensation in the limb, then aching, the pain at these areas of the legs, and then nighttime twitching when one is sleeping. So these are all the symptoms of restless leg syndrome. Restless leg syndrome also, most patients of these problems suffer from periodic limb movement disorders, which is called PLMD, limb jerking during the sleep, which is an objective physiologic marker of disorder associated with sleep disruption. Prevalence with the symptoms at least once per week occurs. Women are more affected than men, approximate 2:1 ratio, and about 2.7% of the population of the world suffer this problem. Caucasians are more prone than people of African descent, and here one can see the while sleeping, the person changes the posture from the right side to the midway, then on the other side. So the patient just have the movement of the legs and unrest during the sleep, moving from here to here. Now, what are the causes of disease? Cause is unknown in most people. However, it has been associated with obesity, smoking, iron deficiency and anemia. Iron an essential cofactor for the formation of L-DOPA, precursors of the dopamine. Then in pregnancy, nerve disease, polyneuropathy associated with hypothyroidism, heavy metal toxicity, toxins, and many other conditions which is causing the polyneuropathy. Now, continuing the causes, other hormone diseases like diabetes and genetics have some role. 60% of cases of WED or RLS are familial, inherited in an autosomal dominant fashion. Six genetic loci have been found by the linkage are known for this problem. Opioid detoxification provokes RLS like symptom during the withdrawal and surgery of any kind, especially the back surgery or the injury, can also have this presentation. Kidney failure associated with vitamin and mineral deficiency like magnesium and the folate is also responsible, and aging is also one of the cause. Now, if we just go into the causes of the restless leg syndrome, so the number one is alcohol or nicotine or the caffeine taking, then pregnancy in the last trimester, then neuropathy, nerve damage, and then sleep deprivation, and the other is end stage renal disease, and the last is iron deficiency, which are said to be the major causes of RLS. Similarly, restless leg syndrome affects 36% of the pregnant women in the third trimester. It also increases the risk of poor daytime function, poor sleep quality, and excessive daytime sleepiness. That is the irresistible urge to move the leg when lying down at night. So that have been seen in pregnant women. Now the causes continued poor venous circulation of the legs like varicose vein in CVI. Certain medication cause it secondarily like antiemetics, antidopaminergic medicine, certain antihistamines, antidepressants, both older tricyclic antidepressants and the newer SSRIs antidepressant, antipsychotics and anticonvulsants, caffeine, alcohol, H2 histamine blockers like ranitidine and cimetidine are also notorious. A rebound effect of the sedative hypnotic drugs like benzodiazepine withdrawal syndrome also present the RLS. So, to have the RLS in the different way, the person can have that feeling and said it is a fan. Some said that it is a spear. Some say that it is just like a snake. And some say it is like a tree. And then it is like a rope. So all these are the syndrome which are having this feeling of the patient in RLS and in PLM. Now, did you know that Jahangir Khan won consecutively 555 consecutive matches over the last 5 years and 8 months? That was the biggest winning streak in the history of any sports. No sportsmen have got defeat and have got one consecutive 555 matches, and in 5 year and 8 month span no defeat has occurred to him. Now, associated problem with RLS are the blood ferritin is always below 50 microgram per liter, and some have increased iron stores, and fibromyalgia, sleep apnea, and Parkinson's disease, and the POTS disease, and certain autoimmune disorders such as Sjogren's syndrome, celiac disease, and rheumatoid arthritis also present with RLS. Neurologic conditions, spinal cerebellar atrophy, spinal stenosis, and lumbosacral radiculopathy also present like RLS. Then the Charcot-Marie tooth disease type 2, 80 to 90% association with the periodic limb movement disorder, which is called PLMD, which causes slow jerks or the flexions of the affected body parts during the sleep. PLMS, that is the periodic limb movement while sleeping, that is called PLMS, or while affecting, that is periodic limb movement while affecting, that is PLMW, periodic limb while movement. Now, what are the symptoms of RLS? It starts at any age, including childhood. It is a progressive disease for someone. 45% of the patient had their first symptom before the age of 20 years. It is an urge to move due to uncomfortable sensation occur primarily in the legs, maybe in the arms or elsewhere. The sensations are uncomfortable, painful, antsy, electrical, scraping, itching, pins, and needle-like feeling, pulling, crawling, and numbness, limb falling asleep. Characteristic nighttime worsening of the symptom in the person with RLS lead to the insomnia and discomfort for the patient. Now, the symptoms, if we just go for that, that restless syndrome is characterized by burning or tightening sensations like in insects crawling inside the leg that typically worsen when the patient is at the rest. So there is crawling movement, itching, throbbing, and the pulling on the legs, which are the main symptoms of restless leg syndrome. Similarly, symptoms are annoying and causing unease, prickiness, hot feeling, a feeling like insect crawling beneath the skin, shaky legs, urge to scratch, urge to thump the legs. Legs move haphazardly, a feeling like electric current, and there is pain, there is spasm, uncon- uncontrollable urge to move legs, and sluggishness, itching, and all these are the main symptoms for RLS. So, because of the lack of sleep, children and adults are very drowsy, irritable, and aggressive during the daytime hours. The worsening of the symptoms is by the relaxation, and sitting or lying down, reading, plane ride, watching TV can trigger the sensations and the urge to move. Movement brings immediate relief, but temporarily and partial. Walking is most common. Stretching, yoga, biking, or other physical activity also gives relief to the symptoms, and continuous fast up and down movement of the leg or rapidly movement legs towards then away from each other also help. So what restless syndrome feel like? Again, the repetition, burning, creeping, itching, aching, crawling, and similar to the electric shocks. and variability over course of the day and the night cycle occurs. Symptoms are worse in the evening and early night. Some experience RLS only at bedtime, others experience it throughout the day and the night. Most sufferers experience worst symptom in evening and least in the morning. These symptoms make sleeping difficult with daytime difficulties like late at work, going for work, and missing the work because of the drowsiness.